Wow, wow. The quarter. The colleagues have tried.
My name is Epenyu Andrew. I'm the Deputy Director, Salem Brotherhood Uganda Limited. Salem is a non-governmental organization founded in 1981 by some volunteers from Germany, and it started mainly as a project to support the vulnerable populations, the children, especially the orphans. We graduated into managing infectious diseases and with a major component in primary health care. So since 1981, we have grown into a bigger project. We now have a hospital. We have a nurses training school. We still maintain the children's home, which is one of our core activities in supporting the vulnerable. In the background, fast forward, you can see that we have a new structure to be commissioned next year, which has the theater, very modern theater funded by German doctors, and the maternal child health unit, which supports the big arm of the reproductive health of the project. Today particularly, we are gathered here to witness a handover of bicycles that support our community arm. We do a lot of community work in primary health care. The component today we are covering is prevention and management of malnutrition in the communities of Bukedia, Mbale, Budaka, and Butebo. So basically we have been around for some time, and we do a lot of community work.
Now, as a facility, we have different services ranging from preventive, curative, and rehabilitative. We have a well-organized laboratory which performs chemistries and basic hematology investigations to improve our care. And we have about 4 wards. We have the pediatrics, general ward, the maternity side, and then the nutritional ward with the private ward. We also have the component of, we have other departments which support the facility. We have the radiology department, we have a digital X-ray machine, and we have the ultrasound, which help in the diagnostics. We also have a functional mortuary. As a facility, we have a functional ambulance. These are in line with our focus to improve quality care to the less privileged people, to the vulnerable in the rural urban setting. We are located in a rural urban setting, so in these places we try to provide the services which are affordable to the people, of course with different challenges. We of late, as a facility, we focus on providing quality surgical care, maternal and child health to really promote the safe motherhood, but also we have a robust community-based component where we reach out to different communities and do routine outreaches. And this is where we actually found that there is a recurring problem about nutrition, and you know nutrition affects a good number of people. From the UNICEF report shows that almost 1/3 of children in this sub-Saharan Africa are stunted, and also Uganda is part of this. And as nutrition, the malnutrition affects even the mothers, and because of malnutrition is a broad thing. In our area here, we talk about the undernutrition, but also micronutrient malnutrition, where we have many cases of anemia, and this affects the mothers who are pregnant, and affects the mortality and morbidity of mothers. So in this focus, we were looking at how do we then improve the nutritional component. And this was from our strong component of the community that we realized that this is a recurring problem, and it is a problem which is multi-phased, that we needed to involve the community. So we have about 4 interventions. One is to have the public sensitized, and through trainings, through sensitization meetings, but also to have build the capacity of the community through training of VHTs and empowering them. And this is what we are seeing. We are giving the VHTs bicycles today and megaphones to facilitate them to have these services. But also we are building capacity of health workers, and we are working with about 16 health facilities in in 4 districts. And we are to empower them so that they have the capacity to train and also screen these cases early and reach out for management. Because we know the malnutrition problem affects the community, and we want to prevent this.
Naida Doreen, and I'm the project coordinator managing malnutrition in Eastern Uganda in 4 districts, that is Budaatwa, Bukedya, Butevu and Mbale. So today we are on a ceremony of handing over bicycles and other things that will help to facilitate our community health workers and peer mothers in the community. And we are having 80 bicycles to give out, and then 80 megaphones, to give out to help facilitate, and many other things. We are giving to Budaatwa, Bukedya, Butevu and Mbale, and we are giving to the VHTs of those places, and also the peer mothers. Of all, this project managing malnutrition started as a pilot project that ran from 2022 to 2023, and when at the end of it all, and when they did the endline evaluation, they found that really the activities that were done during the project had really caused a lot of change, especially in the knowledge, in the attitudes and the practices of the people concerning nutrition. Yes, and so that pilot gave birth to this project that started in June this year. We chose the districts of Bukedya, Mbale, Budaatwa and Butevu following a baseline study. We did a baseline study, and we found that really there is a huge burden of malnutrition, whereby we found about a good number were malnourished, and also almost a third of them were anemic. And we also realized that there were very many knowledge gaps concerning good feeding and all that. Apart from the information that was given to us from the baseline, we also had experience as health workers in the facility, because we had very many children we were attending to suffering from malnutrition, and actually most of them were coming to us with severe acute malnutrition features. And so that caused us to really say, let's, with the collaboration of the German doctors and BMZ, let's go in to continue to manage and prevent malnutrition, because we all should know that malnutrition is not only a 1 day, 2 day, or a month problem. It can decide to be a generational problem. Like if, for example, if a child suffers from stuntedness, most likely that even when they deliver later on in their childbearing age, they will have a child with the same effects. And malnutrition affects the person's capability in cognition, that is their mental capacity. So you find that if at a younger age the child was disturbed because of stuntedness, or the mother, the child may not be able to achieve their potential. Yeah, so it's really a serious problem, and that is. So as these bicycles are being provided to the VHTs, to the peer mothers, to continue to facilitate them in doing their work. Yeah, knowing that they move like from home to home, community to community. We want to make their work easy, and so we really expect that their work is going to be easier, and they are going to have even better output. They are going to reach people that are even in more remote areas. Yeah, and so in that way they'll be able to teach, they'll be able to do the screening of these children, they'll be able to kind of diagnose these children early, and therefore link them up to nearby facilities for help.
Again, my name is Max Kiefer. I'm the representative of German doctors. We are a German NGO that focuses on providing health around the world. And we have been closely working together with Salem for the last years now. We have been implementing also the already mentioned pilot project that we are now hoping to, that we're now expanding with this project. The project is funded by the German Ministry for Development and Cooperation, and also by a small part of our own donations. So we're really looking forward to this project, which has just started now in June, to really take on and have the impact that already the pilot project had, but at a smaller scale. And now we are really happy that we have with Salem such a competent partner in really doing the work on the ground, and yes, malnutrition here in eastern Uganda and the 4 districts. Well, first of all, we have had, as I said, the cooperation with Salem already ongoing, and our aspiration really is to build a strong partnership, not only from project to project, but like really strong partnership together, because we see that there are, yes, of course, in the terms of malnutrition, there are problems here, but also in other areas, and yes, we're always looking out for opportunities. I think this one is an especially strong partnership, as I said, because we have been really, really successful with the pilot project now, and I can really see how passionate people here are, how committed the staff is, and like really how strong their impact is.
Yes, sir. Mukyalo kyesibetu tukudiba nange toyanzire. Salem mwebala okola ino. Dala. Era esaawa eno mulimu okutuwaire twawugukola. Tuli kulwanisya obulwaire bwati w'endyembiibi esaawa eno. Era nga mwebala ino bananga bagwira yala mwemwena basaba kukoleraamo nga Salem wetuteekereyo tukole era tulwanisye tusomesya abantu bamanyi kyokukola ngeriwe batuwaireyo tunokola omukyalo. Okusingira ddala okutuwa transport nga magaali ge tugenda okutambuliramu mu bitundu byaffe, kubanga tubadde tubonaabona okutambula okugenda okuvisitinga abantu baffe abalwadde n'abaana baffe abo abali mu kyalo nga bali eyo balina endya embi, malnutrition, balwalira ddala, olabira ddala ng'omuzadde yakweka omwana mu nnyumba. Naye kati saawa nitugenda okutambula enju ku nju nga tusomesa abantu baffe baveeyo babeere nga bakola emirimu, babeere nga bayirabirira abaana baffe, okusingira ddala okusomesa abakyala babeere nga balima enva endiirwa okulaba nti baliisa abaana baffe ebintu emmere eri balancing diet, abaana baffe bakule nga balungi.
Amia Mustafa Tegu, omusawo omutendeke community health worker, nga nvuyira Namanyonyi ku health center eyokusatu. Nsanyuse nnyo okumpa entambula, mbadde nkola nga sirina ntambula, naye kakati nfunye amaanyi g'amaanyi nnyo, ngenda kutambula mulyango ku mulyango, ndina essanyu ly'amaanyi nnyo, era nsimba omugenyi omukulu Dr. D okola omulimu gw'amaanyi nnyo gwa ntendo era ngenda okukola omulimu n'omutima gumu. Alhamdulillahi rabbil aalamiina. Ng'omusawo omutendeke tugenda okusooka kwennyini tugenda kusomesa abantu ebikwatagana n'endiisa embi ey'abaana basigale nga baliisa abaana obulungi, abaana baffe bakule bulungi, naddala abaana okutandikira ddala ku myaka 5 okudda wansi babadde bakola bubi naye kakati bagenda kukola bulungi ku lwaffe n'omwoyo omulungi. Alhamdulillahi rabbil aalamiina.
Sokolaki na bulo.